Hello, this is Gary Crowley with video 3 of 3 for lower left side back pain relief. In the first video, we released basically the muscles in the upper half of your left hip primarily that yank on your hip bone and your tailbone and can cause your low back to hurt. In video 2, we released your iliacus muscle on the inside of this pelvis that wraps the inside of your pelvis and kind of is the other side of those hip muscles. So when that's tight, it can cause your low back to hurt. And here in video 3, I'm going to show you how to release the basically outer quad and IT band on the right side of your body, because a lot of times that'll cause pain in your left lower back. When these get tight, they basically kind of yank across your pelvis by yanking on your sacrotuberous ligament, this big thick ligament that attaches to your tailbone, and a bunch of other things, and it will cause pain on the opposite low back. So what we're going to do here, and again I show you all this on the techniques page, how to do each of these techniques I'm going to show you, but we'll do it here, is we're going to be doing a press pull release technique where we take our fingertips and we just basically press in this tissue, basically the outer third of your quad and the side of your leg. And first you just want to investigate and see how tight things are, and if they're tender, it means they're tight. If healthy tissue does not hurt when you press on it. So if it hurts when you press on it, it means it's basically inappropriately tight. Now as you notice, I'm doing a press, pull, release, and then on that same spot, press, pull, release, press, pull, release, press, pull, release, until it lets go and is not tender anymore. Now with big strong muscles like this, I like to do what I call a hand-on-hand technique, where while I'm doing the press, pull, release, I'm pressing with the palm of my hand onto my fingertips. That allows me to get a lot more pressure on that tissue without wearing out my poor fingers here, because I'm just using my shoulder and hand here to do the pressure, and this basically gets to do the press, pull, release. So we just press, pull, release all the way up, and when you find your tender spot, stick on it for a while, dig on it. If it's really stubborn, maybe move up to another spot for a while and do some other work elsewhere, and then come back to it. You'll find it'll be a little more likely to let go. And then on the side of your leg, we're going to do the same thing. Any tight spots? I'm doing a hand-on-hand. I'm almost, just because of the angle of things. Now you can use your left hand as the hand that does it, or your right hand, whatever you want, or if you get tired, you can switch it up. I'm right-handed, so I tend to just use my right hand a little bit more, but it doesn't really matter. It's pretty much just as good with my left hand. But again, find a tender spot, press, pull, release, press, pull, release, press, pull, release. You're never massaging this. Massage doesn't tell your brain to release it. Massage does other good things, but it doesn't do what we're trying to do here. So press, pull, release, go all the way up. And then after you do this, you want to self-assess. And you want to notice, okay, how's that low back pain? Now I also, on occasion, just to mix it up a little bit, I guess, because sometimes things will let go doing different things. If I have a really stubborn spot that won't let go, I'll kind of throw my leg over this bolster here or something just to lift it a little bit. I don't know why I seem to like that better, and then I just do a press hold move all the way up my leg, pressing on all those little tender spots. And when you press on it and make it function, it tends to release. So press, and you can even do that for a little bit, then do a press, pull, release, press, pull, release, press, pull, release, and you can mix it up a bit, but that's always a good one to add to the mix. And then, again, you self-assess, notice how much it helped, and then again, because we're here and we're already doing it and it's already familiar to you, you should check the actual left side and release any tender spots, especially if you notice that this side is really, really, really tight, then this could be the culprit. And you release that, you self-assess, and who knows, maybe that was because of the way you drive or the way you sit at the computer or the way you sleep. Maybe this side on you was what was really doing it. Because everybody's a little different. We're all the same, but we're all different. So you just got to pay attention to what works for you. So again, these were the three usual suspects in these three videos that I just did for back pain in your lower left side. But the main lower back pain relief page basically has everything when it comes to kind of chronic structural pain where something isn't ripped or broken that can relieve your lower back pain. So if this didn't do it for you 100%, please do visit the main lower back pain relief page. And I do thank you for your time, and I look forward to hearing how it goes. Thank you.